Hi everyone, it's Wednesday. Happy day to you. Today I thought I would spend a little bit of time talking about some new testing that has come to the forefront and is available. I've been reading a book by Tony Robbins called Life Force, and there are some absolutely fascinating things in there, but one of the things that is discussed in this book is a test by a company called GRAIL, called GRAIL, spelled like gallery with an I on the end of it, but they pronounce it GRAIL. And it's a fascinating blood test that can screen for cancer, 50 different types of cancer, in a way that we've never been able to do before. And I just wanted to tell you a little bit about it and let you know that we are offering this. And should you want to avail yourself, I'll kind of walk a little bit through the test itself. But it's basically a blood test. What we know about cancer is that 1.8 million people in the United States every year is diagnosed with cancer. 40% of us within our lifetime will be given a diagnosis of some type of cancer. And what we know is that if we can detect this early, and it's not like we have great preventive ways of doing this, it's only about early diagnosis. So if we can really detect things early, we have a great shot at curing it. Whereas with many cancers, and particularly the ones we don't have great screening tests for, we are diagnosing much later in different stages and therefore don't have great results long term. And so if we can really detect some of these types of cancer early, we can really take care of it. We know that globally, 9.5 million people die of cancer every year, and a third of the 1.8 million people in the United States that are diagnosed with cancer die every year. That's 1,600 people a day in this country. And the average cost for any type of cancer care is about $250,000, and that's just the average cost. It can certainly be up in the millions, especially with some of the newer drugs that are available out there. And interestingly enough, some of these more costly drugs are adding months, days, weeks, months, not years to life. So it's a real challenge these days from a treatment standpoint. But what we know is that it's widely understood that the immune system is the thing that protects us from cancer. And when we have aberrant cells that are growing, and we make cancer cells every day, but we tend to be able to clean them up. And certainly as we age, the immune system ages as well and is not as robust. And so therefore we're at risk. And we know from what we've been talking about through the last 2 years of videos is that insulin resistance is a huge detractor and suppressor of our immune system. So there are things that we actually have some control over where this is concerned. But if we have a test that we could use to diagnose early, it would be an amazing thing. And it's a fascinating story how this particular test came about. A company was studying pregnant women and were studying DNA in the blood of pregnant women to see if they could detect fetal abnormalities in the blood. And what they discovered is that they were seeing fragments of DNA and RNA that were actually more related to cancer. And they were then able to find cancer in these pregnant women just by accident as they were trying to just study this blood for fetal abnormalities. And then they put together just about 6 years ago, a study protocol where they took 10,000 people with known cancer and 5,000 control people and began to build their database. And through that, they have come to be able to, with basically 98.9% ability to actually diagnose abnormalities. Now, when they do these tests, what they find is that only about 1% are positive. So it's not, when they're doing screening tests, we're not seeing a huge amount of people that are being diagnosed with cancer, fortunately. So we don't need to fear this test. 99% of people actually have a negative test, but it's great to be able to pick up these cancers. And the number of cancers, there's 50 of them. And just to read through this real quickly, adrenal cortical carcinoma, the areas of the entire gut up and down the gut, the bile ducts, bone, breast, cervix, colon, rectum, esophageal, gallbladder. There are different types of gastrointestinal, the gestational trophoblastic neoplasms, kidney, larynx, and a lot of the bloodborne types of cancer, leukemia, lymphomas, liver, lung, melanoma, nasal pharynx and nasal cavity type cancers, neuroendocrine disorders and tumors, oral cavity, oral pharynx, ovarian cancer, fallopian tube, penile cancer, plasma cell cancers, prostate, pancreatic cancer, all along the small intestine and soft tissue sarcoma type cancers, testes, uterine cancers, vulvar and vaginal cancers as well. So a broad array of those that are most often diagnosed. The most commonly diagnosed are going to be the bloodborne lymphomas, Hodgkin's and non-Hodgkin's, but many of them are still diagnosable, but that's the most common one. And I think that the company called GRAIL would just like to let you know that these are tests that they're looking at fragments of RNA and DNA. It is not covered by insurance at this point in time, but they do offer payment plans. You can use a health savings account or a flex account with this. The cost of the test is $949. And that seems like an awful lot, but it is thought that over time, obviously this will come down in price, and it's hopeful that insurance someday will cover it because the cost savings will be immense when you look at it globally in terms of what a diagnosis of cancer at a later stage would cost. And so this test is generally back within 7 to 10 working days, and there is backup in terms of medical counseling and assistance in helping for should we have a positive result. But I think that what's going to happen over time is that, not having to do a colonoscopy, or at least for screening purposes. It's not that you won't ever have to do it. Certainly if there's a positive test, then the follow-up test will be done. But if you can avoid having to have that type of test done frequently, if you can avoid having to necessarily have a mammogram done just for screening purposes, then, and a lot of the other tests, we don't have great diagnosis tests for pancreatic cancer, one of the most deadly cancers. And so to have this particular test, even at $949, which seems cost prohibitive, something that we would do every perhaps 3 to 5 years, might be just a cost savings at the end of the day. So the test is called Galleri. It's from a company called GRAIL. We do have it available. The company does do their own billing, but we would draw blood here. And I think it's the wave of the future and the direction that we're going, because if we can diagnose, like I said early, we are way ahead of the game. And even though it's not a preventive thing, which is what we talk about all the time, having a tool like this that gives us a much better option for early treatment, we are so much better off. So if you have any questions or want to learn more, you can go on their website and look at their testing. It is, I believe, let me see exactly if it's Galleri or GRAIL, but it's GRAIL, G-R-A-I-L, and the test is Galleri, G-A-L-E-R-R-I, and you'll find plenty of information if you just look those up. And if you have further questions or choose to do the test, you can call and schedule at your convenience. Hope you all have a great week, and we'll talk again next week.